I'm Dr. Dimitrios Kostopoulos, co-founder of Hands-on EMG Testing and the residency director of the Hands-on Diagnostics residency program in clinical electrophysiology testing. From time to time, you may be referring patients for EMG testing, or perhaps you are performing EMG testing within your office. But I must tell you, who performs the testing makes a big difference. With the rise of technician-run EMG labs, there has been a widespread, dangerous misconception that technicians are qualified to perform EMG testing. And let me be absolutely clear, this is false. While some technicians may hold certifications to conduct nerve conduction studies, needle electromyography, needle EMG, is an invasive procedure that must be performed by a licensed healthcare professional. As a matter of fact, it is illegal for a technician to insert a needle or interpret EMG results. Yet this is happening, and it puts patients and the accuracy of your diagnosis at risk. So what are the differences between a technician and an ECS board-certified physical therapist? A technician, if some weeks or months of training, and can only conduct the mechanical part of a nerve conduction study, and that under supervision. But an ECS certified physical therapist, electrophysiology clinical specialist, he has undergone years of advanced training, passed rigorous national board exams administered by ABPTS, and he has completed supervised cases, hundreds of them. As a matter of fact, the professionals of hands-on EMG testing are residency graduates where they have spent hundreds and hundreds of hours of supervision and testing to achieve their residency graduation. So at hands-on EMG testing, every study is performed by a provider who is either board certified in clinical electrophysiology or a candidate for board certification who has completed a multi-year ABPTRFE accredited residency program and hundreds of mentorship hours under direct supervision of an ECS certified mentor. We're proud to say that hands-on EMG has achieved laboratory accreditation with exemplary status by ACEWM, a distinction that ensures the highest standards in diagnostic testing. So if you are a provider looking to refer your patients for high quality, physician trusted EMG and CS testing, go to www.emgreferral.com, or to learn more about what we can do and how we can help you and your patients, please reach out directly at info@handsonemg.com or call us at 1-855-364-8378. Thank you for your time, and remember, who performs your EMG testing matters.